Hello Bombers, Richland High School here. It's Mental Health Awareness Month, and every Monday we will have a video that gives information about mental health. Throughout this series we will cover 13 important questions regarding mental health. Our goal is to educate and inform our students and faculty. We want to break the stigma and bring light to the subject. What is depression and what should someone do if they think they have it?
Hey Bomber family, a little bit about depression. What is it that we can do to best help our friends or relatives that may be suffering with depression? First, don't assume that it's just going to go away, that they need to just think happier thoughts or say a prayer. And as faithful as I'd love to be, that just doesn't work. Depression has two faces as I understand it. One, situational. We get into a rough patch of life and it just kind of overwhelms us and we lose our fire, our passion, and over time that can become a habit, almost a way of seeing life, and it's slow coming and it doesn't just go away. So don't assume that it will. The other type of depression that I'm much more familiar with is clinical depression, and that is genetic and it is definitely not gonna just go away. So if you're ever trying to help someone with depression, don't tell them just to snap out of it, because it'll just make it worse. On the bright side, there are ways that we can help. Be uplifting, listen. You probably don't have to give advice when you're listening. Quite frankly, advice isn't necessarily going to help. Sometimes you'll probably recognize that someone could use some extra help, and you might encourage counseling.
Depression, which is commonly used to describe emotional distress or sadness, is different from clinical depression, which is a mental disorder. Clinical depression is a common but serious mood disorder. It causes severe symptoms which affect how you feel, think, and handle daily activities such as sleeping, eating, or working. To be diagnosed with depression, the symptoms must be present every day for at least 2 weeks and must be severe enough to cause you to stop doing the things you would typically enjoy doing. What does a panic attack look like?
I think a panic attack looks different from person to person. Sometimes it can look like someone having troubles breathing or they don't like where they are. It just kind of depends.
I remember one of my friends, she has had panic attacks a lot, but mostly she was quiet. She didn't say anything. It was all inside of herself. So it's kind of hard. It was kind of hard to see if she was having a panic attack. I've had experiences with them in the past also that are similar to that.
A panic attack can look like a pounding heart, sweating, trembling or shaking, shortness of breath or feeling of choking, chest pain, feeling dizzy, lightheaded, numbness or tingling in the body. Young people who experience panic attacks greatly fear having another one and may avoid situations or places they fear might trigger a panic attack. The persistent worry about having a panic attack may trigger another one. Some students say they fear they are losing their mind or feel as if they might die. How do you think someone can differentiate anxiety from normal worrying?
Someone can differentiate anxiety from normal worrying by depending a lot on the time. Like, anxiety is much more chronic and will be reoccurring, whereas normal worrying is more based off an event or something that could come up like a test.
Occasional anxiety is a normal part of life. You might feel anxious when faced with a problem at work before taking a test or making an important decision, but anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. Young people are often present with physical complaints such as headaches, fatigue, muscle aches, and upset stomach. These symptoms tend to be chronic and students may miss school or social activities because of their physical symptoms. Anxiety differs from normal worrying in that the feelings interfere with daily activities such as job performance, schoolwork, and relationships.